How to Prevent Atherosclerosis, Complete Guide. Welcome to our medical information channel. Today we will take a comprehensive look at how to prevent atherosclerosis, a condition that silently damages arteries and significantly increases the risk of heart attack and stroke. This is a topic that affects millions of people worldwide, yet many people do not fully understand what it is or how dangerous it can become if left unaddressed. Atherosclerosis develops gradually over decades, which means that the lifestyle choices you make today have a profound impact on your cardiovascular health in the future. We will cover everything from the basic causes and symptoms to cutting-edge prevention strategies and treatment options available today. Whether you are concerned about your own heart health or want to protect your family, this video will give you the essential knowledge you need to take action. Please watch until the end to get the most complete and potentially life-saving information. What is atherosclerosis? Atherosclerosis is a chronic inflammatory disease characterized by the buildup of plaques inside the arterial walls, gradually causing the vessels to narrow and harden over time. These plaques are composed of cholesterol, fatty substances, calcium, cellular waste products, and fibrin, which accumulate when the inner lining of an artery becomes damaged. As the plaques grow larger, they restrict blood flow and reduce the supply of oxygen and nutrients to vital organs such as the heart, brain, and kidneys. In some cases, a plaque can rupture suddenly, triggering the formation of a blood clot that can completely block an artery and cause a heart attack or stroke within minutes. Because the disease progresses slowly and silently over many years, it is often called the silent killer, as most people have no idea they are affected until a serious event occurs. Understanding this condition at a fundamental level is the first and most important step toward protecting your long-term cardiovascular health. Causes and risk factors. The development of atherosclerosis is driven by a combination of modifiable and non-modifiable risk factors that together determine an individual's overall cardiovascular risk. High blood pressure, elevated LDL cholesterol, cigarette smoking, and poorly controlled diabetes are among the most powerful risk factors because they directly damage the inner lining of arteries and promote plaque formation. Non-modifiable factors such as age, male sex, and a family history of early heart disease mean that some individuals start at a higher baseline risk regardless of their lifestyle choices. Obesity, physical inactivity, chronic psychological stress, and an inflammatory diet rich in processed foods and trans fats further accelerate the atherosclerotic process at the cellular level. Emerging research also points to chronic low-grade inflammation, poor sleep quality, and air pollution exposure as additional contributors to arterial damage. Identifying which risk factors apply to you personally is essential for crafting an effective and targeted prevention plan with your doctor. Main symptoms. One of the most dangerous aspects of atherosclerosis is that it typically produces no symptoms during its early and intermediate stages, allowing it to progress undetected for decades. Symptoms only begin to appear when the arterial narrowing becomes severe enough to meaningfully restrict blood flow to specific organs or tissues in the body. When coronary arteries are affected, patients may experience chest pain or pressure known as angina, shortness of breath during exertion, fatigue, or in the worst case, a sudden heart attack with crushing chest pain radiating to the arm or jaw. If atherosclerosis affects the arteries supplying the brain, warning signs can include sudden weakness or numbness on one side of the body, difficulty speaking or understanding speech, vision disturbances, and severe headaches, all of which may indicate a stroke or a transient ischemic attack. Peripheral artery disease, caused by plaque in the leg arteries, commonly presents as cramping leg pain during walking that relieves with rest, cold or discolored feet, and slow-healing wounds on the lower extremities. Any of these symptoms should be treated as a medical emergency or urgent concern and evaluated by a physician without delay. Diagnosis methods. Diagnosing atherosclerosis involves a combination of clinical assessment, laboratory testing, and advanced imaging technologies that together provide a comprehensive view of arterial health. Blood tests are typically the starting point, measuring levels of LDL and HDL cholesterol, triglycerides, fasting blood glucose, C-reactive protein as a marker of inflammation, and kidney function to assess overall cardiovascular risk. Non-invasive imaging studies such as carotid artery ultrasound can detect and measure plaque buildup in the neck arteries, while an ankle brachial index test compares blood pressure in the ankles and arms to screen for peripheral artery disease. Coronary CT angiography has become an increasingly popular tool because it can provide detailed three-dimensional images of the coronary arteries and calculate a calcium score that reflects the total plaque burden in the heart vessels. In cases where significant blockages are suspected, a traditional invasive coronary angiogram may be performed, where contrast dye is injected directly into the arteries and visualized using X-ray to precisely locate and measure the degree of obstruction. Early and thorough diagnosis allows doctors to stratify risk accurately and implement the most appropriate and timely interventions before a catastrophic event occurs. Prevention strategies. Preventing atherosclerosis is absolutely possible and highly effective when a comprehensive, multifaceted lifestyle strategy is consistently applied from an early age. The most powerful dietary approach is adopting a Mediterranean-style diet rich in olive oil, fatty fish, nuts, legumes, whole grains, and colorful vegetables and fruits, all of which have been scientifically proven to reduce LDL cholesterol, lower inflammation, and protect arterial walls from damage. Regular aerobic exercise such as brisk walking, swimming, or cycling for at least 150 minutes per week strengthens the heart, lowers blood pressure, raises beneficial HDL cholesterol, and helps maintain a healthy body weight that further reduces cardiovascular strain. Completely eliminating cigarette smoking is one of the single most impactful steps any person can take, as smoking rapidly accelerates arterial damage and dramatically increases the risk of plaque rupture and blood clot formation. Managing chronic stress through mindfulness meditation, deep breathing exercises, social connection, and adequate sleep of 7 to 9 hours per night helps regulate inflammatory pathways that contribute to atherosclerosis progression. Annual health screenings to monitor blood pressure, cholesterol, blood sugar, and body weight allow you and your doctor to catch and correct any developing risk factors before they cause significant arterial damage. Diet and nutritional management. Nutritional management is arguably the most powerful tool available for preventing and slowing the progression of atherosclerosis, making dietary education an essential component of any cardiovascular health program. Saturated fats found in red meat, full-fat dairy products, and tropical oils like coconut and palm oil directly raise LDL cholesterol levels and should be limited to less than 7% of daily caloric intake, while trans fats found in partially hydrogenated oils should be eliminated entirely from the diet. Omega-3 fatty acids found abundantly in fatty fish such as salmon, mackerel, sardines, and herring have powerful anti-inflammatory properties that protect arterial walls, lower triglycerides, and reduce the tendency of blood to clot dangerously. Soluble fiber from oats, barley, beans, lentils, apples, and citrus fruits acts like a sponge in the digestive tract, binding to cholesterol and removing it from the body before it can enter the bloodstream and contribute to plaque formation. Plant sterols and stanols found naturally in nuts, seeds, and certain fortified foods have been shown in clinical studies to reduce LDL cholesterol by 5 to 15% when consumed regularly as part of a balanced diet. Reducing sodium intake to less than 2,300 mg per day by cooking at home with herbs and spices rather than salt, and strictly avoiding ultra-processed convenience foods, can significantly lower blood pressure and reduce the overall inflammatory burden on your cardiovascular system. Treatment options. When lifestyle modifications alone are insufficient to control cardiovascular risk factors, modern medicine offers a highly effective array of pharmacological and procedural treatments that can dramatically reduce the risk of heart attack and stroke. Statin medications such as atorvastatin and rosuvastatin are the cornerstone of medical therapy for atherosclerosis because they not only lower LDL cholesterol by 30 to 60% but also stabilize existing plaques, making them less likely to rupture and cause acute events. For patients who cannot tolerate statins or need additional LDL reduction, newer agents such as PCSK9 inhibitors, ezetimibe, and inclisiran offer powerful alternatives with strong clinical evidence behind them. Antiplatelet medications such as aspirin or clopidogrel reduce the risk of blood clots forming on top of plaques and are standard therapy for patients who have already experienced a heart attack or stroke. When significant coronary blockages are identified on imaging, minimally invasive procedures such as percutaneous coronary intervention with balloon angioplasty and stent placement can restore blood flow with a relatively short recovery time compared to open surgery. In cases of multiple or complex blockages, coronary artery bypass grafting surgery may be recommended to create new pathways for blood to reach the heart muscle, dramatically improving symptoms and long-term survival in appropriately selected patients. Expert medical advice. Leading cardiologists and cardiovascular health experts worldwide consistently emphasize that atherosclerosis prevention must be viewed as a lifelong commitment rather than a short-term intervention, ideally beginning in childhood with the establishment of heart-healthy habits. Adults over the age of 40, and younger individuals with multiple risk factors, should undergo a formal cardiovascular risk assessment with their doctor at least once every 1 to 2 years, including measurement of blood pressure, full lipid panel, fasting glucose, and body mass index. Experts strongly caution against self-medicating or self-diagnosing based on online information, as cardiovascular risk management requires individualized medical judgment that accounts for your complete health history, current medications, and personal risk profile. The importance of medication adherence cannot be overstated, as studies consistently show that patients who take their prescribed heart medications as directed experience dramatically fewer heart attacks and strokes compared to those who discontinue treatment on their own. If you ever experience sudden severe chest pain, unexplained shortness of breath, sudden facial drooping, arm weakness, or speech difficulty, you should call emergency services immediately rather than waiting to see if symptoms resolve, because every minute without treatment during a heart attack or stroke causes irreversible tissue damage. Building a trusting, open relationship with your healthcare team and attending all scheduled follow-up appointments are among the most protective things you can do for your long-term heart health.